Hi, this is Cynthia, and I'm here to talk to you guys today about vaping. So we have a lot of patients and people out in the community that are vaping, and we need to know about this topic. Are we asking people if they're vaping and about their vaping history, or just about smoking? Because we need to be thinking about vaping, and then we need to know enough to have conversations with people and the different types of situations that are likely to come up when we interact with our patients and with the public. So I'm going to talk to you about Vaping 101, what nurses need to know. So e-cigarettes came to the US in the early 2000s, around 2003. They look like over on the far right, like they look similar to traditional combustible cigarettes, but they were disposable. And then within a few years, the market just exploded, and there were all these different electronic devices or e-devices, from like in the middle, something that's really futuristic and round in the palm of your hand, or tiny, it looks like a little USB drive, vape pens, kind of like the third in here next to me, something that's long and skinny and uses a disposable cartridge each time. There's even bigger machines that are like have a refillable tank that you fill up with the e-liquid or the vaping liquid, and you can plug them in. Using any of these types of devices, we're going to call vaping. And what they have all in common is the power source. Frequently, it's a rechargeable battery, or it could be just a lithium battery, or some of them do plug in, like the bigger machines. They heat up a heating coil, which then heats up and aerosolizes a liquid called the e-liquid, which is inhaled. So one big important difference between cigarettes, traditional cigarettes, and vaping is that vaping is non-combustible. So in smoking, something does catch on fire and you breathe the smoke in, and you get some of the carcinogens from breathing smoke from a fire. And also some things like tar and stuff that are in the cigarettes. You don't have that in vaping, but there's some other real issues about vaping. So one thing we might want to know is, like, what's in that e-liquid that's being aerosolized and breathed in? Well, usually flavors. So flavorings like sweet flavors, unusual flavors. This is one of the characteristics of vaping and why people do it. So there's probably flavorings in there besides just like menthol or something. There's going to be like blue raspberry, cotton candy, cherry, stuff like that. Then it could contain no nicotine, a little nicotine, or a lot of nicotine. But usually vape liquid or e-liquid contains a lot of nicotine. So the biggest manufacturer in the US is Juul, J-U-U-L, and they control greater than 75% of the marketplace in the US. And so, for instance, a Juul pod that you would put into like a vape pen, like these over next to me, one Juul pod contains the nicotine content of 20 traditional cigarettes. Not 20% more, 20 times more. So one of these cartridges equals the nicotine of an entire pack of traditional cigarettes. So vaping tends to be at a very, very high nicotine level. All right, so let's talk about what we're going to call this. We'll call all of this vaping. Sometimes it's called Juulings just because they're so... they're everywhere in the market and they control so much of the market share. So people say they're Juuling instead of vaping, just like I might say, like, hand me a Kleenex when I mean hand me a tissue, because it's just a really big brand. We could call these devices up here vapes, these electronic devices. We could call them vape pens. That'd be like the ones maybe closer to me, long and skinny. We could call them e-cigs or electronic cigarettes, e-cigarettes. That's going to be more like the one on the far right that still looks like a traditional cigarette. They can be disposable or reusable. They're still around. Or we could call them mods. So a mod would be like this square thing that's kind of close to me. But you can call the device a mod, or you can also call an action doing a mod. Because sometimes people will take, like, say you have these round colorful ones in the middle, break it open, expose the coil, heat it up, drip the e-liquid right on there and inhale it without any filter. And that's called doing a mod. So terminology. And if you were reading the literature, looking at some studies about the health impact of vaping or prevalence or epidemiology of vaping, you might see these two acronyms, ENDS and ATPs. ENDS, electronic nicotine delivery system, and ATPs, alternative tobacco products, would include things like any of these vaping devices. So who is vaping? Well, let's talk about first our adolescents. So people under 18 years old. We have over 3 million high school students currently vaping in the US. And I don't mean like ever tried, because that's something we say in epidemiology is when did they ever try, or substance abuse, did they ever try? But this is people who are regular vapors daily or several times a week, over 3 million high school students. That's getting pretty close to about 20% of the high school students in the US who are regular vapors. 550,000 middle school students, or about 5% of middle school students, also vape. You might say, well, how does that compare to smoking traditional cigarettes? Well, about little under 5% of high school students smoke traditional cigarettes. That's down from almost 16% in 2011. So traditional cigarettes went way, way, way down. Vaping went very quickly up in a steep curve. One thing you want to know about those cigarette smokers in high school, though, is they're probably dual users. So there was a very big collection of studies, like a systematic review of all the studies, all the good quality studies that looked at health impacts of vaping up to 2018. And it was collected by the U.S. Academy of Sciences, Engineering, and Medicine. It was this enormous document, and some of the information that got out of that. So some information is pouring in. In fact, you know that all the time we get new information about health impacts of vaping. But one of the things they determined from from those studies was that adolescents who vape are in fact more likely to also begin smoking traditional cigarettes in the future. So it is a risk factor for smoking. And we know from all the decades of public health that nicotine has a particularly detrimental effect on developing adolescent brains. And so you want to think about the fact that most vaping is going to be at this very high level with much more nicotine than traditional cigarettes. And think about the health impact. There's some other things we know about these adolescents. We know that they like the sweet flavors. So more than 90% of adolescents said they like the sweet flavors, like cherry, blue, raspberry, cotton candy, that kind of stuff. Not just like mentholatum or a less sweet flavor. This information is coming from the 2020 U.S. Youth Tobacco Survey, which is done periodically by the federal government, by the U.S. Department of Health and Human Services. So it's a very big study with a lot of data in it. So it's a good study. So why does it matter if they like sweet flavors or not? There's two reasons it's significant. One is because it turns out that sweet flavorings are correlated with more lung damage from vaping, unfortunately. So there was this term that was coined in the 1990s that was called popcorn lung. And it's because there were these workers that were working in the Orville Redenbacher popcorn factory, and they were making butter-flavored popcorn. So I hope that you didn't think it was actually made out of butter, but it's not, of course. The butter flavoring is like, chemical esters, artificial flavorings. And so these artificial flavorings of butter flavorings were being aerosolized into the air. And then over time, the workers in the factory were breathing this in, and they started to develop COPD-like symptoms, including some pulmonary fibrosis, shortness of breath, and that kind of stuff, some irreversible lung damage from breathing in those flavorings. And that is popcorn lung, and that's what's happening to people that vape sweet flavors. So sometimes we see lung injuries from that, and it's like that type of popcorn lung. The second reason that it's significant that they like sweet flavorings is because it could be construed as drug marketing to minors. Right? So we already did all this. So back in the 1970s, I don't know if you're familiar, but there were the Great Tobacco Wars in the 1970s. And we had Philip Morris and some other enormous tobacco companies, but that was the main one. And this tobacco war went to Congress, it went to the Senate, it went to the Supreme Court. And some of the things that were found, one of the big decisions was, it said tobacco companies cannot market to children. And so Joe Camel, who used to be a cartoon, couldn't be a cartoon anymore. No more advertising on media that was primarily consumed by children. So it couldn't be on Saturday morning cartoons or in any kind of magazine or something geared towards children. And sweet flavors of cigarettes were removed from the shelves in America. But then vaping started, and it was basically unregulated, and it's still like not very regulated. And it was kind of like a free-for-all. So, like, take a look at this. These are some containers that have different e-liquids with great, cherry flavor, lemon lime, blue raspberry, stuff like that. And I ask you, like, who do you think this is being marketed to? Adults? So some people are very upset about this. For instance, like the entire Commonwealth of Massachusetts sued Juul in a class action lawsuit, which I believe is still ongoing, for direct marketing to children. And so we'll have to see how that works out. Another thing that we know about this group of adolescents who vape is that most of them did not ever previously smoke regular cigarettes. They just started for the very first time with vaping. So they started at this very, very high nicotine level, probably, because that's how most of the e-liquids are. And just think about what we know about nicotine and adolescent brain development, and you can see why a lot of people are very concerned that this might be a health crisis. Also, we know that this group of vapors have some real misconceptions. So there's been a lot of studies that just ask teenagers, middle school and high schoolers, do you think it's healthy or not? Do you think it has any nicotine? A little bit, a lot? Do you think there's any health impacts? And what we know is that generally they're not concerned about health impacts. Frequently, teenagers think there is no nicotine or at least a lot less than cigarettes, and that it's fairly healthy for you. Now, here's one of the things, because what's one of the big urban myths out there? When people are vaping and the secondhand vapor is coming off, what do they say? Oh, this secondhand vapor is just what? Just water vapor. But it's not just water vapor. So what's in that secondhand vapor? Well, is there nicotine in it? Yes, there definitely is. So just like you could get absorbed nicotine from being in next to someone smoking a traditional cigarette, it's the same for vaping. There are some proprietary chemicals that are in those e-liquids. So we got flavorings, probably nicotine, probably a lot of nicotine, and then some proprietary chemicals. Proprietary meaning we don't, as consumers, get to know what they are. A lot of times they're not listed on the label. It'll just say substances to stabilize flavorings or something like that. But these chemicals are used to help aerosolize the e-liquid, and like Juul uses a proprietary chemical system to help enhance nicotine absorption in the lung tissue, more absorbed and at a more efficient rate. Some of these chemicals that are also extruded in the secondhand vapors include benzenes. So benzenes are carcinogenic. They're like what's in car exhaust. We all know that it's very unhealthy to breathe in car exhaust. Formaldehyde is in there, which is also in Diet Coke, but we don't want to breathe it any more than we really should be drinking it. And also some heavy metals will be in there, which is maybe different than traditional combustible cigarettes. We do not want those in our lungs. Teenagers are basically unaware of a lot of health impacts of vaping, and they're not even very concerned about it. And they don't even think they're getting any nicotine. What about adults? So by 2018, we had over 8 million adult vapors in the US, but they're a little bit different. And I do want to tell you, of the adult group, it skews young. So most of these people are going to be between 19 and 25 years old, and your main demographic is young white males. But what we do know about this group that's different from adolescents is many of them previously smoked cigarettes. In fact, the further you get over 25 years old, the more it's a correlation. The more people, adults who vape, started vaping specifically as a way to quit smoking, hopefully. So, for instance, there was a study by Villarroel et al. In 2020, and they only surveyed vapers who were over 30 years old. And in that group, 57% had tried vaping specifically as a possible method of smoking cessation. So a lot of people think they'll move from cigarettes to vaping, and then they'll be able to get off vaping, and then they'll be able to quit. what is the difficulty with that? Okay, well, there's a couple of things we should probably know. One is that the evidence so far is inconclusive. Now, we do have providers who are advising people to switch to vaping, and we're certainly trying it out, and there's a ton of studies going on about vaping and smoking cessation. But in 2020, Huang et al. Did a systematic review and gathered all of the data just on if vaping was a good method of smoking cessation, and looked at everything to that date in 2020. And when they read through it all, they said inconclusive. So they could not show that vaping was an evidence-based practice, that it was particularly helpful. It was inconclusive. So it worked for some people, didn't work for a whole lot of other people. Inconclusive. And based on that, the FDA did not approve vaping as an FDA-approved method of smoking cessation. So that's important to know. Why is it so hard? I mean, and is there a place for vaping and smoking cessation? I think there probably is. But what you have to think of is, like, when we help people stop smoking, we think about stopping their cravings and controlling their withdrawal while the nicotine level is slowly brought down. Because the nicotine is what is so addictive, right? It's extremely addictive. In fact, some studies show it's equally as addictive as heroin. Now, it's not as harmful as heroin, but it's equally as addictive and difficult to quit. So it's very, very addictive. And if you're smoking cigarettes and you're getting this much nicotine every day, and you switch over to vaping, and suddenly one vape pod is 20 times the nicotine of one cigarette, and now you're at a much, much higher level of nicotine. So you might make it successfully off cigarettes, but now how are you going to start bringing this down? Ideally, you would like to go straight across. So you'd want to go from this level of nicotine on regular cigarettes, vaping at this level. But to do that, you have to know what the nicotine content is of the e-liquid, and there's a lot of variables, and we know that labeling is horrible. So another one of the things that came out of that big compendium of research from the Department of our National Academy of Sciences, Engineering, and Medicine was that consumer labeling was terrible and often fraudulent. So, like, there were some studies where they got a bunch of products off the shelf, vape liquids. They compared what was listed on the consumer label, then they tested the liquid in the lab, and a lot of times they don't match. So the label might say no nicotine or very low nicotine, and it has very high level of nicotine in it. And a lot of times it's just proprietary chemicals. You're not even allowed to know what's in there. So that makes it hard to do evidence-based, like especially healthcare provider managed smoking cessation using vaping when we can't even get good information. But we know that the way to stop is to bring your nicotine down, 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 and going up here first thing makes it hard. Now, you do break a habit. So people who have been successful smoking cessation by going to vaping say, like, one of the things that helped them, it's like cognitive behavioral therapy, was to break the habit of buying cigarettes, lighting cigarettes, smoking cigarettes. They're doing a different thing now, and that helped them to start a new phase and break that habit. Also, you don't get the tar, you don't get the carcinogens from the fire and the breathing in the smoke that you do from cigarettes. But vaping has its own difficulties, like popcorn lung and EVALI, which we're going to look at in just a second. So we just have to give people this information, right? Like, there might be a place, but it takes a lot to understand how to do it successfully, and people don't know any of this stuff. All right, so let's look at the landscape. What else is out there? Okay, EVALI. This is an acronym that stands for e-cigarette and vaping associated lung injuries. Now, in early literature, it has a different one. I think it was VAPE for a while, but now we've settled on EVALI. So this is going to be like probably irreversible lung damage, like pulmonary fibrosis, that people get from vaping. So like popcorn lung. And we would suspect this maybe if somebody comes in with COPD-like symptoms, they're very short of breath, they've been vaping heavily, they're younger, they have no previous history of any type of COPD or anything like that. And then we're going to connect it with the vaping. But are we doing that on our intake form? Are we asking people if they vape and what their vaping history is? Like, how are we going to notice it and treat it if we're not screening people, if we're not assessing them for that behavior? So There's not one specific test to define something as EVALI, although there is a radiologic finding, which is ground glass opacities on the CT of the lungs or CT of the chest. And then you put it together with their other symptoms. Then we know, so we got to know about EVALI. Oh, and I should tell you that there is one type of vaping behavior that's most closely associated with higher rates of EVALI, because we know that there's other things that you can vape, right? Besides just flavors and nicotine. There are other things. People are vaping some other stuff. So you can vape cannabinoids, THC products. And when people do that, it's usually suspended in like a vitamin E oil. And some people come in who want to put like doTERRA aromatherapy oils into their vape thing and vape it. As healthcare providers, we know that breathing a bunch of oils in to coat the inside of your alveoli it's no good. It's no good. No bueno. So we need gas exchange to occur. And there is a higher rate of EVALI with people who are vaping THC products, and it's usually because it's suspended in vitamin E, and it's that vitamin E oil that's especially associated to EVALI. And so people are vaping other oils. They're also at very high risk of EVALI. We know about the secondhand vapor. It's not just water vapor. You wouldn't want to be stuck in an enclosed area like a car with people vaping, just like you wouldn't want to be stuck in there with people smoking cigarettes. And then we know about vaping for smoking cessation is a little bit complicated, and it's inconclusive scientific information at this time. The studies are inconclusive. Sometimes it helps, sometimes it doesn't help. Sometimes people do better on traditional cessation. Sometimes they did okay on vaping. So the jury's out on that. And it's not FDA approved as a cessation method. And it's difficult if you make it to vaping to stop vaping because of the very, very high nicotine levels. So those are all things we need to know about. From the consumer's point of view, what do they need? They need some information. People have so much lack of information, misinformation, which is not a coincidence, right? They are getting their information about vaping from the internet and social media. So I tell you, they're not getting it from their healthcare providers by and large. And I'm just going to ask you, how good is healthcare information from social media? I know what I think about it. So no wonder people are confused. And regulation was very slow to start and very tricky to manage. So basically, like, manufacturers could say anything they want. And there was a very interesting study that came out of USC School of Communication, where they took, like, I can't remember, it was hundreds of thousands or millions of tweets, it seemed like. And they were looking for tweets about vaping and the words they were most often associated with, like in the tweet. And among the ones that were tweeted by vape manufacturers, the most commonly associated words with vaping or e-cigarette were vegan, vegetarian, healthy, workout, young, fun, and smoking cessation, right? So it's not a coincidence that there's misinformation. This is the way that manufacturers are marketing and selling their product. Like, we don't have so many traditional commercials anymore. The manufacturers hire social influencers and have them, feature their product or their tweeting, right? That's really tricky for the FDA to regulate. Although they have fined a couple of social influencers when they say things like, oh, I feel so much healthier, there's no nicotine, and that's a blatant lie, and they have fined it. But it's really patchy and hard to follow up on. So, in fact, it was such a lack of regulation for the first at least 5 years or more. Some people got very upset about it. And one of those peoples was the American Lung Association. So in 2018, they sued the FDA for failure to regulate the vaping market, saying that they were not holding these manufacturers accountable to the same pre-market standards of testing and information truthfulness that we were for a lot of other things that consumers are eating, drinking, smoking, right? The vape manufacturers just seem to have a free pass for everything. So this went to court, and the American Lung Association won this suit against the FDA. And in 2019, some of the things you saw from that were that those pre-market rules were enforced. Regulation did go up. So that meant a lot of products came off the market. There were so many products, and a lot of them weren't testing anything and just putting stuff out there. A lot of those had to then come off the market. So it shrunk it down. And also in 2019 is when we saw the legal age to buy vaping products go up to 21. And that was from this suit. Also, the president at that time made a speech saying what a positive step forward it was, and that sweet flavorings, the next thing was to remove all the sweet flavoring vape juice e-liquids from shelves across America, but we haven't seen that happen yet. So maybe in the future. And the last thing to mention is just new social norms. So we know that, for me, and maybe people a little bit older than me, our parents and our grandparents, like a lot of times you'd lose all 4 grandparents to smoking, COPD and lung cancers, or your parents, depending on your age. But now, like a couple generations younger, they haven't had that experience. And so the further away you are from history, the more likely to repeat itself. Also, when I was growing up, we were in the era of still trying to actively deglamorize smoking. So everywhere I was in school, you'd get messages about how smoking was terrible for you, and it made your skin ugly, and it gave you lung cancer. There was a massive campaign to deglamorize smoking, and it worked because smoking rates went down, 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 down. But then vaping happened, and it skyrocketed. And we have nothing like that kind of counter-market campaign occurring at all. There's nothing to fight the disinformation. So it's kind of like all those decades of public health, it's just gone backwards a little bit. Consumers need accurate information. So let's try to help. So we're going to talk about, yes, I got to tell you about this. So the U.S. Surgeon General in 2016 published a big research paper, a big summary about health impacts of vaping, particularly on the adolescent, the youth of America, knowing what nicotine can do to adolescent brain development, and said this is a public health crisis, and put out a call to action for healthcare providers, specifically naming registered nurses. And what they wanted us to do was incorporate vaping into all of our patient assessments, intake forms, healthcare policies, patient education, health promotion activities. So any place that we would say smoking, let's add in vaping. That was 2016. So it's been a minute. Like, we should have had time to integrate this into our clinical practice. So are we doing it? I'll tell you, like 2 years ago, I took my 17-year-old son in for a sports physical to the pediatrician. But he was aging out, but he was still at the pediatrician. They do a great job there. And then they said, is it okay if we talk to him for a second, And I was like, sure. But then I'm nosy Nancy. So as soon as he came back, I said, like, okay, so what'd they say to you? And he said, they said, like, am I drinking alcohol and it's not good for you, and don't do drugs, and do I smoke cigarettes? And I said, well, did they ask you about vaping? And he said, no, they didn't ask me if I vaped. And I'm like, it's so weird because he knows other kids in high school who vape, but he doesn't really know any who smoke cigarettes. So if we're not asking, especially patients under 30, about whether they vape and their vaping habits, we're missing the boat if we're just asking them about smoking. So the last thing is, let's talk a little bit about how to have these conversations with patients, like a couple strategies for you. Okay, so we want to find out, like, are they ready to quit? Make sure they know some important facts, like about the nicotine, the secondhand smoke, that kind of stuff. And is it our role? I think it is our role as registered nurses. So if you go onto the American Nurses Association website, you will see there are 4 key responsibilities of a registered nurse, and one is health promotion and patient education. It's on QSIN. It's on the NCLEX. Now, in transparency, I do have to say vaping does not appear on the NCLEX, but health promotion, public health, patient education is like 16% of the NCLEX. So I think it is our place. And when we're talking to these patients, just keep in mind we're going to assess them for what they know, where they are, and try to meet them at that place. in a non-judgmental way. And then we're going to provide information, facts that are helpful, and then we're going to try to hook them up with resources. This is our steps that we're going to go through. We are not trying to tell them not to vape, or at least that's my approach. I don't try to tell people not to smoke, not to vape. I just want them to make an informed decision, right? So like I even say to my students, or, if I'm training people or whatever, if you smoke, that's okay. It's not that I don't like you. It's not that I won't be your friend, but I feel like everybody understands what cigarette smokes, the price you could potentially pay and what the downside is. And then you choose if you want to do it or not. But I don't feel like it's like that for vaping. And it's being targeted to people who especially don't know the information and have trouble making those decisions. I just want people to understand what they're truly consuming and then make an informed decision. And then I'll support them. Whatever I can do to move their health forward, that's what we're going to do. And we'll always do it therapeutically. So let's look at a couple of them. Let's say I picked up 4 patient scenarios that I think these are typical people we might see. How about an older patient in their 60s who smoked for decades and they don't really know a lot about vaping, but they want to try it because they've tried to stop smoking so many times and they heard maybe this is a good method of smoking cessation, and they ask you for advice. How could you engage in that conversation with that person? So you got to meet them where they're at. You're going to assess their knowledge level and also their situation. So how long have they been smoking? Do they live with other smokers or other vapors? Do they have any COPD, or they're being seen by a physician? Like what are their physical signs and symptoms? Okay, so let's meet them where they're at. And then if they say it's better, do they just mean cost? By the way, is vaping less expensive than smoking regular cigarettes? I think it probably is. And especially if you're doing the refillable tanks where you can fill up the liquid, it's a lot less expensive than buying those packs of cigarettes. But they probably mean acute health and chronic health symptoms. So let's talk to them about nicotine levels, about secondhand vapors, about E-volley and popcorn lung versus the real dangers of continuing to smoke regular cigarettes, and then help them come up with a plan and start providing the facts and alternatives. And just to throw it out there, do they plan to stay vaping for the rest of their lives? Or are they hoping to quit everything? Because maybe the American Lung Association has a slogan that says, quit, don't switch, because it's so hard to get off of vaping because of the high nicotine content. Maybe now is the right time for them to finally hit smoking cessation, and we would hook them up with get up an appointment with their provider. We'd see what resources we have at our facility. We'd start them on things like nicotine patches. Sometimes people require a medication like Zyban or something because they're smoking so much and we don't want to have those withdrawals and cravings. Okay, how about this situation? A teenager who smokes daily, never smoked cigarettes before, not really concerned about health impacts, doesn't even think there's nicotine, and you have just a few minutes to have a little conversation with them. When you're talking to adolescents, attitude and approach really matter. So as you assess where they are, do they live with other smokers or vapors? It's going to be hard if all their friends vape. Like, I'd take this into consideration. Do they play any high school sports? This might be a motivating factor. But we want to talk to them in a conversational way that's very non-judgmental. And you might only get a few minutes. Sometimes there's a limited attention span, especially if this sounds like a boring lecture that they don't want to hear. So get in a couple facts that make a big impact about the realities of nicotine, what's really in secondhand vapors, what flavors do you like? Ooh, I hope it's not the sweet ones, because those have more irreversible lung damage. But we want to end on a positive note. You never want to be such a downer or such a harbinger of doom that people just turn you off and feel like, well, I'm doomed now. I'll never be able to quit. Right? So we want to end with a positive message and hook them up with some resources. Like an app would probably be a great thing for an adolescent. And there are some really good apps to quit vaping that have a social media element. I'm going to show you some of those in the very last thing. Let's say you had somebody who's a parent of a baby and a toddler at home. They smoke cigarettes, but they're worried about secondhand smoke. So So they say, well, what if I change to vaping because it's just water vapor? All right, let's figure out who else is at home. Do they have any health symptoms? Have they tried to quit before? Give them the information. There's even a thing called third-hand smoke, which is in the literature from vaping. Because of the heavy metals and stuff in that secondhand vapor, it will settle on surfaces in your home. And then babies or pets go through it, and the hand goes to mouth, and then they consume some of those substances like benzenes, formaldehyde, heavy metals. Will children who are driving around in the car today with the windows up with their parents vaping have the same level of childhood asthma and maybe adult asthma as we did from my youth when people were driving around with cigarette smoke? Not my parents, but a lot of people when I was growing up. We will see, right? Because basically all the people vaping now are part of this big ongoing healthcare study, and we're going to see how many get COPD, how many get lung cancer, how many children get asthma. We're gathering this information right now. Someone who's really concerned about their kids, maybe this is a time to quit, don't switch. Is it the right time? And then we'll hook them up with resources right away, because it's hard to get off of that vape pen. One of the things I say to people sometimes is, do you see yourself smoking like forever, or do you think you'll quit eventually? And tons of people say, oh no, I'll definitely quit. It's just that right now it's like really stressful with my job, and this just happened, and there was a death in the family or whatever. And then so you say, well, if you're going to quit in the future, like that gives you an opportunity to bring that conversation up, that how you could help them right now get started. If they already know they're going to quit in the future, maybe this is the time. How about someone who is vaping daily? They're in their mid-20s. They've been doing it for a couple years, but they're starting to feel a little worried about health impacts. And they ask you about cessation from vaping. Are they having any symptoms? What do they know? Okay, then do they live with other vapors or smokers? Let's share some of the facts with them, and then let's hook them up with some resources. And the time to start is right now, and the key is going to be bringing down that nicotine level. It's very hard to do with just patches or gum, because like, how many patches you going to put on your arm for 20 times the nicotine per cigarette? It's rough. They might need a healthcare provider to help them out with this, right? Couple resources. This is our last thing here. Know your facility resources. So you probably have smoking cessation educators, or at least information if you work at a healthcare facility. Maybe it includes information about vaping, but usually not. But maybe it could be applied for your patient who vapes. So first, know what your resources are at your facility. There's something we call the 5 A's of cessation. If you Google it for smoking cessation, it will pop up. Ask, advise, assess, assist, and arrange. We should be asking people about vaping every intake, every new patient assessment, every ER visit, every time. Advise. When we advise people they should quit, we got to be direct. Like, we don't want to hurt people's feelings. So we say, well, it might be better. I mean, vaping might be a little better because you don't get the tar. Let's just tell them the truth, and that it would be very good to stop vaping. There's a lot of healthcare advantages health impact advantages to your health to stop vaping, and make a clear message. So it's evidence-based that people are more likely to take action when they receive clear messages from people that they trust, like healthcare providers, and nurses are the most trusted profession in America. So let's tell them, time to quit. Then we're going to assess their willingness to try, hook them up with resources right then. So assist their attempt to quit, and arrange follow-up. So like a provider visit, get them into a support group, something like that. Here's a couple resources. The American Lung Association, lung.org, has a great website with a lot of information about vaping, health impacts of vaping. So you want to stop vaping, on their website. You could look it up on your phone and show it to a community member or patient. Anybody can call this number that is on their website as well and get a person and say, I'm interested in quitting vaping, or I want to quit smoking and I thought maybe I'd try vaping, and speak to a counselor from the American Lung Association. And we might want to hook them up with their physician for help, especially if they're like COPDers who are being managed by a physician, then this process should be under physician's care. I just hope that they know a lot about vaping. And the last thing is apps. So there's a lot of apps in the store to quit. So there's like a great one that's just called Quit Vaping that has really good graphics. It's highly rated. Teenagers would really like it. It has a big social media component. And like these, you get badges, you get points that like motivates you to keep going. There's a great one just called Quit Genius. It works for smoking, vaping, and other behaviors. Use cognitive behavioral therapy to track the money you've saved, all these different improvements to your life. It also has a support group, like a social media component where you get put into a little support system. There are some really good apps. You could bring one of these 2 apps up and show it to the patient. All right, we're done. So if you have just been listening for my class or my study, you don't have to watch anymore. Thank you so much. I'm just going to do my contacts and my references from this point forward. So I am Cynthia Reber, and I am a full-time faculty member at Dixie State University, which is now transitioning to be Utah Tech University. Very excited. And also this presentation is being done as part of my dissertation process for my PhD at William Carey University. So there is my contact for William Carey, and here's my current contact for where I'm a full-time faculty member. And I'm going to just put some of my references up here. You'd have to freeze it and really want to see those to look in there, but quite a lot of references. And thank you so much for watching, and I will talk to you again.